Hello, hi, good evening, everyone. Welcome back to another OET Speaking Speculation Live. This is me, Richard Caroline, joining you from Nidus Academy. So, yes, welcome back, all of you, and I hope you're staying safe and healthy and your preparation is going well as well. So, yes. This is another Tuesday. At the same time, I'm here back with another recent exam model card discussion with you guys. And today, I have brought a little big of a huge card for you guys, okay, because this card is going to be looking really big with a lot of tasks, and each task has a lot of sub points, so that this actually looks very huge. So you might feel like, okay, this is really big, I have a lot of points to cover, so will I be able to finish everything? You'll be doubting yourself. So that is a card that we are going to do today, okay. അത്യാവശ്യം വലിയൊരു കാർഡായിരിക്കും. ഞാൻ കഴിഞ്ഞ ദിവസം ഇത് സ്പീക്കിംഗ് ക്ലബ്ബിൽ ഡിസ്കസ് ചെയ്തൊരു കാർഡായിരുന്നു. And I thought, okay, I'll take it to the live as well. The reason being, ഈ ഒരു കാർഡിൽ കുറേ കാര്യങ്ങൾ പഠിക്കാനുണ്ട്, കുറേ കാര്യങ്ങൾ നമുക്ക് മനസ്സിലാക്കി എടുക്കാനുള്ളതുണ്ട്. അപ്പോൾ ഐ തോട്ട്, okay, why not? Let's discuss it together as well. So without wasting much time, let's get started. I'll display the card here. Remember, you have 3 minutes. It's a huge card, so make sure to read fast. But when you're reading fast also, remember to get the gist of what is happening in the card too. Okay, so your time starts now. This is the card. Alright everyone, so welcome back. I hope you got enough time to go through the card and you understood the points mentioned here. So let's have a quick look at this card. So the setting is given as the cardiology department. When you read through the background detail, you can understand you are a nurse preparing a 72-year-old patient for a pacemaker installation. The patient, who has a history of bradycardia, is visibly anxious about the upcoming procedure and is asking you a lot of questions. So this is the background detail that we have here. And your first task is to confirm the reason for the visit. It is given as pacemaker installation in the bracket. Find out if the patient has any questions or concerns about the procedure. So now, let's have a quick look at the context here. So as you can see, the context is given as cardiology department, and when you read through the background information, we can pick up the details like you are a nurse preparing a 72-year-old patient. The patient is there for a pacemaker installation. The patient has a history of bradycardia and is visibly anxious and about the upcoming procedure, is asking a lot of questions. So from this, you need to figure out whether this is a known case or an unknown case. It is pretty much simple to understand. This is a known case for sure. Okay? And now we need to find out whether this is a first category known case or a second category known case. When you look at the details, you're not finding any information which is telling you that this is the first time, this is not the first time you're talking to the patient, or this is your patient, you have been dealing with this patient for a few days right now, or you have examined the patient already. The information onnum thanne thannitillathathu konde we have to take it as the first category known case. And your first task is to confirm the reason for the visit. So we'll be asking, are you here for the pacemaker installation? So this is the organization of your introduction and the details so far. So now let's see how we are going to do this. You can do it in two different ways. During 3 minutes, you can ask for the name and you can start the role play with the greeting, and then you can ask like, are you Mr. Matthew? So he's saying, yes, I am Matthew. So Mr. Matthew, I believe you're here for the pacemaker installation, and then you can introduce yourself, or before that also you can introduce yourself. You can plan it accordingly. Or what you can do is you can just skip the 3 minutes preparation time without asking the name of the patient, and in the role play you can do it for the verification, like you can deal it like an appointment case, like whether the patient has booked an appointment and you're dealing it like that. Okay, so let me show you the two different introductions you can try here. Okay, so but before that, let me note it down for you, so please take a note of it. So one point is like this. During 3 minutes, I asked the name and I got the name as Marcel. This is the name of the patient. So I decided to greet my patient. Since it is the first category, I need to give my self-introduction, and then I need to verify patient details. Okay. And then I will confirm task 1. This is one way of doing it. Now another context of doing it is, let me make sure that you can visibly see what I'm writing here. Just a minute. Yes, good evening Danya. Let me rearrange the screen. Just give me a second. Yes, then it is the category 1 known case. Good job. Okay, so I hope you guys can make it out. The first one is greet, self-introduction, verify patient details, confirm task number 1. Okay, another method of doing it is Without asking the name of the patient in 3 minutes, what you can do is you can directly greet the patient, give your self intro, and you can verify the patient detail, but like this. For the verification, can you please tell me your name? Okay, and after that you can confirm task number 1. So these are the 2 different ways of doing it. So let me construct the sentence and show you how this can be done. So for the first method, that means this method. Good evening, my name is Richa. I'm one of the registered nurses working in this cardiology department. You must be Marcel. Hello Marcel, if I'm not wrong, you're here for the pacemaker installation, isn't it? Yes. You seem to be really anxious. Is there anything bothering you, Mr. Marcel? This is how you can do that point. Okay. Now, if I'm going with this one, I will say, hi, good evening. My name is Richa. I'm the registered nurse on duty today. For the verification, can you please state your name and age? Hello Marcel, when I check my system, I can see that you're here for the pacemaker installation, isn't it? Yes. You seem to be a little anxious, Mr. Marcel. Is everything all right? Or do you have any concerns or questions about the procedure? So this is how I can plan my introduction. I hope it's clear to both of you. So no, all of you. So I hope you got an idea about how these both things can be done. Okay. So this is the proper introduction for this context. Now, let's look at the next point. So when you ask this question, find out if the patient has any questions or concerns about the procedure. What I did is I connected this point with this information, visibly anxious about the upcoming procedure. So I clubbed it together by saying, you seem to be anxious. You seem. I have heard many students saying you seems, you looks, which is wrong. You don't need the S, okay? You seem to be anxious, or you look really anxious. Are you or do you have any questions or concerns about the procedure? Simple as that, okay? Do you have any questions or concerns about the procedure? This is how you will ask that question. So when you ask that question, definitely the patient is going to ask you, yes, I would like to know what exactly is the pacemaker for, what exactly it does, and what is it. I have no idea about what that is. So when the patient raises a concern, always remember, whenever the patient raises a concern, it is important that you acknowledge the patient's concern and then you get into the task explanation. Do not directly jump into your task explanation. You need to first acknowledge and then do the task explanation. Okay, so here I can say something like, Marcel, I can sense how worried you are about pacemaker installation. Then you can say, don't worry, let me explain everything to you. Let me explain everything to you. Let me explain everything to you. So this is how I will be giving an acknowledgement there. Okay. So once this acknowledgement is done, I am going to start with the explanation of what is a pacemaker or what the pacemaker does. So I'm going to say the pacemaker, again I'm going to start like that. A pacemaker does, I'm going to change that to the pacemaker. Then I'm going to use exactly what is mentioned here. Regulates heart rate and is crucial for patients with slow heart rate. Instead of this word, they have used slow heart rate, and you can add a point here like you, because the patient is having a history of slow heart rate. Okay, so I'll continue with the statement here. The pacemaker regulates heart rate and is crucial for patients with a slow heart rate like you. And it is important because you're going to explain the importance, right? So you can say it is important because it pumps. So when you look at this verb, you can see it is given with the S there. So you always know with the pronouns he, she and it, the verb will have a S at the end. Okay, so whenever you see verb with an S at the end in the bracket, just put it before it. It will be easy for you to, construct a statement there. So it pumps, it helps, it regulates, it applies, it reduces. So you can connect it like that. All right. Now, if you don't want to use the S word, or you don't want to use with the S, then what you can do is you can take off the S and add to. Okay. Here you can see the word pump enough blood to body. So you can say it is important to pump. Instead of pumps, you will say pump enough blood to the body. Okay, that's the both way of, different ways of doing it. So either you can use to or you can use it. When you're using it, you'll use it pumps. That's the difference. All right. Now, you can construct the statement like this. It is important because it pumps enough blood to body and it reduces risks and it helps patients feel normal again. So what I did is I just added it in front of all the points that is mentioned in the bracket. So I'm going to construct the statement one more time for that. So please pay attention here. This is the task that we are doing. So I'm just going to highlight it as and when I am constructing the statement for it. Okay, so please pay attention for that. Okay, so don't worry, let me explain to you everything about pacemaker and pacemaker installation. So the pacemaker, just a minute. Okay, the pacemaker regulates heart rate and is crucial for patients with a slow heart rate like you. And it is important because it pumps enough blood to body and it reduces risks and helps patient feel normal again. This is how I will construct a statement for that. Okay, now once I have finished it, what I'll do is I will say this point. Now, I hope you have an idea about the purpose of pacemaker. The purpose of pacemaker. This is how we can do it. And now this statement, the statement that I said right now, this will give you a closure for the task. And the closures are always important, so always remember to do that. So this is how you can do this particular task. I hope it's clear to all of you. Yes, Ninu, good evening. Now, once you have completed this, the next point is briefly describe the procedure. So what I'll do is, after I said I hope you understand it, then I can ask a question. Do you have? I need a transition. So I can go with, do you have any concerns? So the patient will ask me about the procedure, so I can automatically move on to the procedure. Don't worry, I'll explain the procedure to you. Now let's see what is the procedure there. Surgical incision. So you can construct a statement. We will make a surgical incision. Okay, and the next point is local anesthesia, but don't worry, we'll be giving you local anesthesia. So since this particular task is future, because we are going to explain about what will happen during and before the procedure. So this is in the future. So you need to be using will be plus verb, ing form, all these formats and these types of tasks. Okay, so You can explain, we will make a surgical incision and don't worry, we will be giving you local anesthesia and you will remain awake but you will not feel any pain. You will remain awake but you will not feel any pain. Now once you have done that, the next task is the same task itself. The next point in that task is to ask question. So whenever there is a change in topic in the same task or in multiple tasks, always remember to signpost. It is important that you do that, okay? Signposting is an important thing because whenever there is a change in topic, you need to tell the patient what is going to happen next. So whenever there is change in the topic, it is important that you tell the patient what is going to happen next. So here you can add, I need to ask you few questions. Okay, do you have any allergies? One question. And have you had any previous reactions to anesthesia? This is how we'll finish it. Okay, do you have any allergies? Do you have any allergies? And have you had any? Have you had any previous negative reactions to anesthesia? Have you had any previous negative reactions to anesthesia? So this is how we'll do it. Okay, so the patient says, no, I never experienced anything like that. So you're moving to the next point, reassure about the procedure. Okay, so you can say that's good to know. I'm glad to know that. Now, I understand you're a little concerned about the procedure, but if it gives you any peace of mind, I assure you that it's not going to be a very long procedure. Typically, it can last for 1 to 2 hours and the success rate is really high. Speaking about the recovery process, you might experience a mild discomfort at the incision site and you might also have limited arm movement for a few weeks. Please remember to avoid heavy lifting or engaging in strenuous activities. Once I have completed this, I can say it is important that you follow these instructions to avoid post-operative complications. Okay, it is important that you follow these instructions to avoid post-operative complications. Is that clear to you? That's how I'm going to finish it. So the patient says, yeah, that is clear to me, and that is the end of that particular task. Now, after I finish it, I am going to interact with the patient. And the next task is regarding following post-operative instructions. So you can ask the patient, do you have any questions? Do you have any questions about the post-operative instructions? Then the patient will ask you, is it really important that I follow everything that you have just told me? Okay, what will happen if I don't follow it? So you're going to explain the points to the patient. Well, Mr. Marcel, it is really important that you follow the post-operative instructions correctly because it helps prevent infection and it supports proper healing and it reduces risk of complications like device displacement or delayed recovery. Therefore, it is important to follow the post-operative instructions. I hope everything is clear. Do you have any other concerns or questions? This is how I'll do it. Here also, you can see that the bracket information, all of that has helps. The word is helps here. Then I have supports, reduces, etc. So what I did is I just added it. It's that simple. It helps prevent infection and it supports proper healing and it reduces risk of complications like device displacement or delayed recovery. Now, do you have any other concerns? So the patient will say, well, I just want to know about how can I use microwaves and things like that. So we're going to explain that to the patient here, okay? So, well, it is safe to use a microwave. We can see that point here. It is safe to use a microwave. And the next point mentioned here is Discuss necessary lifestyle adjustments. It is safe to use a microwave. However, I would like to discuss necessary lifestyle adjustments with you. It is important to avoid strong magnetic fields like MRI machines, and remember to use cell phones on the opposite side. If you don't do so, you might experience some complications. So it might affect the functioning of the pacemaker. So it is advised that you strictly follow these instructions. Is there anything else you would like to ask me? The patient says no. Then you are going to establish that the patient understands and consents to the procedure. So I hope everything is clear to you. That is checking the understanding of the patient. So I hope everything is clear to you. So with your permission, can I start with the procedure, or can I prepare you for the procedure? That's how I will end it up. Okay, so this is the overall execution of this task. I hope all of you got a picture about how this can be done. Okay, now remember, whenever you see huge tasks like this, yes, you might have an inhibition like, okay, will I be able to finish everything in time? Will I be able to finish reading everything in 3 minutes? Will I be able to do it? Don't have that hesitation. If it is big, just try to read everything and try to understand what is the concept, and then just speak. Okay, see how many tasks you can cover, and just make sure that whatever task you're covering, you do it according to the assessment criteria. You're matching every points there. Then you don't have to worry. Like for here, you have 1, 2, 3, 4, 5, 6 tasks, but it is equivalent to having 8 tasks here because the entire card is really huge. You have a lot of points, but the plus point of this card is every task, okay, each and every task that we have here is self-explanatory. Okay, the sentence construction can be that easy. The transitions can be super easy here. Everything is understandable. So just because it is big, there are a lot of points, doesn't mean it is not doable. You can easily do it. You can easily perform it. Okay, so keep that in mind and make sure that you practice reading so that you will improve your and enhance your reading skill, and you will be able to finish reading everything within the given time, and practice sentence constructions like the methods I've told you. Like every student, sometimes they face this difficulty about connecting the main topic with the bullet points which is given there. അപ്പോൾ അങ്ങനത്തെ ബുദ്ധിമുട്ടുകളൊക്കെ നിങ്ങൾക്ക് ഫേസ് ചെയ്യുന്നുണ്ടെങ്കിൽ ഇതുപോലത്തെ ടെക്നിക്സുകൾ യൂസ് ചെയ്യാം. ഇതുപോലെ ഞാൻ വേറൊരു കാര്യം പണ്ട് പറഞ്ഞിട്ടുള്ളതാണ്. whenever you see these points, okay, നിങ്ങൾ ലാസ്റ്റ് ടാസ്ക് ഒന്ന് നോക്കിയേ. you can see the last task here, അവോയ്ഡിങ്. ഇപ്പം ഇതുപോലെ ING ഫോമിലാണ് നിങ്ങളുടെ ബ്രാക്കറ്റിൽ ഇൻഫർമേഷൻ കിടക്കുന്നെങ്കിൽ ആ ING ഫോം മാറ്റാം. Okay, just change the ING and make it like this, to avoid. Okay, that's enough. Okay, change ING മാറ്റ അവോയ്ഡ് ആക്കുക. ഇനി ING മാറ്റണ്ട എന്നാണെങ്കിൽ 2ന് പകരം എന്താക്കുക, 4 ആക്കുക. ദിസ് ഇസ് ഇറ്റ്. അപ്പോൾ ഇങ്ങനത്തെ കുറച്ച് ടെക്നിക്സുകൾ നിങ്ങൾക്ക് അറിയാമെന്നുണ്ടെങ്കിൽ കുറച്ചുകൂടി ഈസി ആയിരിക്കും സെൻറ്റൻസ് കൺസ്ട്രക്ഷൻ്റെ സമയത്തേക്ക് വരുമ്പോൾ കേട്ടോ. അപ്പോൾ അതൊക്കെ വെച്ചിട്ട് നിങ്ങൾ വർക്കൗട്ട് ചെയ്താൽ മതി. ഓക്കെ, സോ ഐ ഹോപ്പ് ഇറ്റ് ഈസ് ക്ലിയർ ടു എവ്രി വൺ. ഓൾ ഓഫ് യു ഗോട്ട് എൻ ഐഡിയ അബൌട്ട് ഹൗ ദിസ് കാർഡ് ക്യാൻ ബി ഡൺ ആൻഡ് ഹൗ ഇറ്റ് ഈസ് പ്രിപ്പയർഡ് ആൻഡ് ഹൗ ഇറ്റ് ഈസ് ഓർഗനൈസ്ഡ്. സോ താങ്ക് യു വെരി മച്ച് ഫോർ ദ കോപ്പറേഷൻ all of you. Keep practicing. So tomorrow I'll be coming back with another recent exam model card. Until then, take care. Have a great night. Bye bye all of you.